We now move on to the next speaker, and that is the Honorable Chirwa-Mpungose from the EFF. Honorable Chirwa-Mpungose, you have 15 minutes.
I thank you, Chairperson. Greetings to the sympathizers of the EFF led by the Commander-in-Chief, Julius Sello Malema. South Africa has a long history of efforts aimed towards addressing the HIV and AIDS epidemic. Majority of those efforts were in actual fact initiated by civil society and ordinary people who did not sit back and watch the government of the day fail us one too many times. Growing up in Mamelodi as a child meant witnessing deaths in our homes and next door, mothers of our childhood friends, our older sisters and brothers, an overflow of media efforts to alert us of the epidemic. Wrong turns were made along the way, resulting in our fear for the virus evolving to becoming a toxic stigma that still haunts us to date as a nation. Being products of many Black women who spoke back to power. One such a woman was Auskidiboni, the daughter of my crash transport driver, Mama Joyce. Auskidiboni was not only living with HIV, but she was also an activist, moving from community hall to community hall in Mamelodi and the surrounding areas, calling for HIV treatment to be made available. I was fortunate enough to have been with her during those times, as she had a passion for young girls and advocacy work. I and many other young girls in Mamelodi are products of an investment in leadership and community activism. Our Skidi was always about shouting at the top of her voice in gatherings, "Re batla dipilisi, re feng dipilisi, re batla go phela." Her cries at the time found no refuge as she lost her life 3 years post these interactions with community members and government officials who would come to engage with our community, carrying with them false promises, false hopes, misinformation, no political will to change the status quo, and no treatment for those who needed it the most. She died. I, as a child at the tender age of 5 to 8, saw the zeal die away with her and her body withering away right in front of my eyes. She is one of hundreds of thousands of Black women we owe our activism and passion to for this topic at hand. Progress was eventually made, thanks to the commitment of civil society. Alas, a million deaths later and no concrete plan on the future. It is thus disingenuous to tell tales of government success in combating HIV and the AIDS epidemic without first acknowledging the thousands of preventable deaths this country has seen and the efforts by ordinary South Africans who fought the government for what is right. These victories don't belong to the ANC. They belong to the people. We were there and nobody will have the freedom of rewriting history because they have power and influence today. The thousands of child-headed households that come from that era are due to the failures of the ANC government. The plunging of young girls into sex trafficking due to losing their parents and thus made more vulnerable is evidence of ANC failures. It is disingenuous to pretend to this nation that this fight was fought by you, the ANC. The truth is that in the thick of it, it is the Black women of this country who took you on headstrong when you were failing to defend the human rights of those who were living with HIV, those dying to AIDS-related illnesses, and children being born HIV positive. It was not out of political will of the ANC that the efforts we speak of today became a reality. Black women had to fight you and your HIV denialist presidents. Black women had to seek international solidarity whilst the government was perpetuating dangerous stigmas of sexual morality while the nation was withering away. And Black women still carry the burden of fighting the government and the HIV and AIDS epidemic to date. Therefore, the EFF celebrates all of them, living and those who have transitioned with reverence and honor. HIV and AIDS first had to demonstrate by reaching those in these chambers, comrades, councillors, ministers, and all the rich, powerful, and elite before the government of the ANC could humble itself and succumb to the wisdom of the mothers of our nation. Lest we forget, the government of the ANC was forced to roll out the prevention of mother-to-child transmission following a constitutional court ruling. You had all the excuses in the book on why you could not save innocent children from an epidemic that bragged and emboldened the socio-economic and social divide we continue to suffer from today. And sadly, this reality that highlights the economic and social divide in our nation is still the case. 30 years into democracy, interventions and innovative efforts aimed at confronting the HIV and AIDS epidemic reach the rich first and those in rural areas last. It is the rich and elite who get post-exposure prophylaxis first. It is the rich and socially palatable who got the education about pre-exposure prophylaxis first. It is the 15-year-old to 26-year-old black girls in Taung who will get the education on PrEP last. The most susceptible demographic, young black girls between the ages of 15 and 26, still cannot walk into a clinic today to request PEP without first having to display a story on trauma, on rape or sex work. Why? Because this government doesn't believe us, young black women, when we tell them that sex in today's day and age for black women is political, sex is social, sex is economic for us, and drugs the same. And we are not to blame. We do not make ourselves poor. And this reality will remain as the status quo until economic freedom is achieved. Preventable infections highlight a deeper phenomenon, Chairperson. It highlights poverty. Poverty does not allow a 17-year-old girl to negotiate condom use with the same person who buys her sanitary towels. Poverty does not allow a pregnant woman to negotiate condom use with the man who pays her rent. And healthcare should never be the price to pay for any human being because it is a human right. A disheartening reality is that thousands of the children who were saved from HIV transmission from mother to child are today the very people that are now getting infected. This means that as the ANC, you are a government that cannot defend its own gains. You are a government that cannot defend your own victories. A government devoid of truth and genuine compassion for the work at hand. Palesa, who is a success story due to PMTCT, is also an unfortunate story because although HIV didn't reach her from her mother during the pregnancy and delivery, it actually reached her at first year of university following being raped and not wanting to report the case and thus losing out on medical intervention that should have kept HIV negative. A government that fails to defend its own victories. The government of today has to graduate from applauding itself for the mere basics. People pay with their lives. Stigma is costly. Lack of knowledge is fatal. And an incompetent government means death for our people. Our Skidiboni didn't have to die, Chairperson. Palesa didn't have to be infected. Both these cases were preventable, but weren't prevented because our government still finds the time to boast when new infections are still alarmingly high for black girls and women. We need more than what you are giving us, and more is definitely possible. Primary health care, prevention and education should at all times be the guiding principles that inform efforts pertaining to all matters of healthcare. Our people don't know that U equals U. They don't know that you cannot contract HIV from an HIV positive person if they are undetectable, and that one reaches an undetectable stage through adherence to medication. To this effect, stigma thrives, secrecy wins, new infections persist. 2 million of HIV positive people are still not on ART to date. A government that cannot defend its own gains. Social media is filled with stigma, vitriol, that alienates HIV positive people and further locks them in a silence we do not afford as a nation. There isn't a single campaign on platforms that are flooded by young people that directly speaks to addressing misinformation that travels faster than access to ART. Implement this with immediate effect, Minister. If the EFF was government today, we would renew the healthcare system through strengthening primary healthcare, real universal healthcare coverage, where people access healthcare as and when they need it, and not just through office hours. Parliament rejected an EFF bill that was proposing 24-hour and 7-day operations of clinics, and in response, provided no true alternative to this innovative intervention of the EFF that our people needs. We would ensure adequate, equitable domestic funding for health that will proactively ensure sustainability and not allow austerity or deficits to impact the health system efficiency. We would use pluralistic, non-siloed approach to health systems and its governance, ensuring coherence with other departments that are key to the success of the public health system and will address the underlying social and commercial determinants of health. This is directly linked to our prior contribution on the multi-layered nature of HIV and healthcare in general. It is political, it is social and economic. Interventions should thus mirror this reality at ground level up. We would ensure integrated access to data to identify gaps in policy, health systems, clinical care and underlying determinants, water, food, housing, healthy living and the working environment. Health data will be rapidly analyzed to inform priority setting for specific districts and sub-districts, foster interdepartmental collaboration to meet the underlying determinants of health. inform resource allocation, and focused budgeting in all our intervention strategies pertaining to HIV as a program. If EFF was government today, no young person would have to justify why they need PEP with sob stories that are unfairly scrutinized by the morality police, who are homophobic and who do not consider that, like them, sex workers are human beings who deserve healthcare rights like the rest of us. Young people need PEP because they have sex. They need PEP because they get raped and do not always wish to report the crime. They don't wish to report rape crimes because your policing and court systems are deplorable. They need government to give them PEP because they don't afford private doctors like you and me. They need PrEP because whether we like it or not, it is basic healthcare. If EFF isn't government today, but we gladly give these interventions in this house so that this government of today, of the GNU, can never claim obscurity when history seeks answers. We are giving you solutions because as the EFF, we are in the business of love and revolution. I thank you, Chairperson.
Very much, Honorable Mpungose Chirwa. That was a very heartfelt presentation.